There's many factors that can contribute to snoring. Some of the issues are just the genetics. Just simple nasal congestion will cause snoring problems. Crowning teeth can cause snoring because there's no place for the tongue to fit in there. You know, we all think of obesity as being a big factor. Something as simple as the position that we sleep in. If we sleep on our side versus on our back, keeps the tongue from falling off and vibrating up against the back of the throat. There's some current studies out now that show that vibration can cause plaque buildup in our carotid artery. So the simple act of snoring, loud snoring, can create cardiovascular problems and stroke. Sleep disordered breathing can be simply snoring, but it can also go to a level where it's absolute stopping of breathing. That's called obstructive sleep apnea. It really is important to see a doctor to look into it, to investigate it, because it's definitely correlated to strokes, heart attacks. It's linked to diabetes. It's linked to Alzheimer's, senility. In fact, oftentimes, I shouldn't say oftentimes, but there are cases of Alzheimer's that have been diagnosed as Alzheimer's when actually they're just a sleep disorder. And to play with treating snoring and sleep apnea. One of them is an ablative laser. That's a laser that cuts and removes, and it's used sometimes to go back into the back of the throat and remove part of the soft palate. This laser is new technology, and as I understand, there's only 100 of us that are using this laser in the United States. This laser is a rejuvenating laser. So it changes the collagen that has gotten older, flabby, softer. In the back of our throat, that collagen is type 3 collagen. This laser beam, by shining on the tissue, warming the tissue, changes it from type 3 collagen back to type 2 collagen, and it causes other collagen to regenerate. The handpiece that we use today to treat my patient, it uses a pulsed energy of laser beam. It's called an erbium YAG laser, and it penetrates very, very shallow, but it triggers the rejuvenation of those collagen fibers. What they can expect on that first visit is a treatment that's going to take 25 to 30 minutes. We have a particular route that we're going to cover in the back of the throat and on the little uvula that hangs there, and we just shine that light on it. That night when they get home, they may, a small percentage of patients say that the back of the throat felt a little scratchy or itchy, and when they wake up the next morning, probably 40 or 50% of my patients report that that night they felt like they slept better. That's what studies have shown by interviewing patients, and so the airway gets opened up that very first night.